Hello, I'm Betty Casey, editor of TulsaKids magazine. We partnered with the Children's Hospital at St. Francis to bring you information about your children's health. Today, I'm here with Dr. Barry Robert Berch. Dr. Berch is a fellowship trained, board certified pediatric general and thoracic surgeon. He provides a broad range of surgical services for infants, children, and teens at the Children's Hospital at St. Francis. Today, we'll be talking about appendicitis. So, Dr. Barry, I'm sorry, Dr. Birch, welcome to our interview. And I wanted to start with the just a general question. What is appendicitis and what are the signs and symptoms that parents should look for?
Yes, good question. This is a great topic, and thanks for having me. I think this is a topic that's a lot more common than a lot of people think. It's certainly a lot of parents, and I think the more people know about it, the more they can get their kids help quicker and more timely, and save a lot of problems, as we'll talk about. But appendicitis is yes, it is inflammation. The word is the appendix, and ascites is the inflammation of the appendix. So, inflammation of the appendix, which can lead to infection and sometimes very severe infections. The appendix is a portion of our intestine. Specifically, it's sort of an outpouching, finger-like protrusion off of the first part of our colon, where our small intestine meets our large intestine. The large intestine is also called the colon. So there's a little outpouching right there called the appendix. It's much debated of what function it actually serves. Uh, Not a lot, mostly to give me work, I guess. A lot of pediatric surgery work for sure. But
Doc, pretty.
yes, that's the appendix.
Well, so appendicitis is when it's inflamed then?
It's when it's inflamed.
Okay, and then what would the signs of an inflamed appendix be? What are the signs and symptoms of that?
Sure. So classically, pain. The child or even adult, we're talking about children today, but the child's going to have the signs are pain. The kid is going to say my belly hurts. Usually that's going to be more on the right side, the right lower abdomen, just above the hip bone area on the right, and more towards kind of between the point of your hip there and the belly button. An area right in there is generally where they're going to hurt in the classic case. But you see kids present in a variety of ways. Sometimes this pain follows some just generalized feeling unwell. They don't feel good. They have maybe some vomiting, fever, nausea, diarrhea. But classically, it starts with they complain of pain somewhere between the belly button and the right lower abdomen.
As you were talking, I'm thinking about my children when they were very young, and I guess appendicitis can happen to toddlers as easily as adults, right? So, is there
Yeah,
is there a way for parents to maybe help them describe that pain, or if they're very young, and what
yeah,
age can get appendicitis?
sure. Yeah, good points. Yeah, interestingly, the most common time to get appendicitis is between 10 or 12 and about 17 or 18 years old. So that's the peak. If you look at charts, is a very common diagnosis, high, very prevalent in our country. There's up to 70, 100,000 cases of appendicitis a year in the United States. And that's some old, maybe some old literature. It may even be higher today. These numbers are kind of hard to put a finger on, but here at St. Francis, we average seeing or operating on one patient a day. We average somewhere between around 300. That'd be 365 cases in a year. And we're doing pretty close to that. I mean, around 300. So anyway, it's very common in that 12 to 18-year-old age group. And I think the most important thing is that parents do understand that it is very common. I think it's misunderstood that a lot of people think, well, kids don't get this, or we have 5-year-olds, we have 2-year-olds with appendicitis. There's even a such thing as neonatal appendicitis. I've taken the appendix out that was inflamed in a baby that was a few days, a month old. That's extremely rare, but it happens.
Well,
Most commonly, it's somewhere, in these 5-year-olds. We get a couple of 5-year-olds a month with it, but more commonly 12 to 18. And, you just have to be very, have a high index of suspicion for parents. I mean, take their complaints, them acting like they don't feel well, take it serious. Their examinations, even by us surgeons and doctors who examine and check kids all the time, specifically their bellies. Sometimes it can be very challenging to tell, do they really have it? Kids are just, they're prone to mask. There's other mask the symptoms easily. It's related to where that appendix is actually sitting in their abdomen.
uh-huh.
Lots of variables. So the most important thing is that parents do take it serious. Get them to their pediatricians, get them to a children's hospital. I think the more specialized evaluation that the child can have, the better. I mean, just running them to the just standard, adult type doctors is not always good enough, because it is challenging, even in the hands of people who see kids every day. So it's important to see, I think, children's specialists to
Uh-huh.
evaluate this, and then we make decisions about using different imaging studies, whether that's ultrasounds, CTs, laboratory tests, to help us hone in on this diagnosis.
Okay, you answered my question about how it's diagnosed, but it does sound like I had no idea. I think it's so important for parents to know that it is it's not common. It's not uncommon, and
Very
I did not know that the really teens are. It's a higher percentage of teens that actually have it. So those are two things definitely I've learned from you today, and the diagnosis sounds like it's not that simple. I mean, having a professional who knows what they're doing diagnose it, because if it is allowed to continue, if a child's appendix is inflamed, what is the end result of that? Does it always need surgery? What happens?
Yes, yeah, that's the big point here, is the sooner we can make the diagnosis and begin their treatment, the better. This can be very easily dealt with. We have great antibiotics and a quick, easy surgery to take care of it. But the treatment is the combination of IV antibiotics and surgery. That is how we treat it. And
Okay.
there's debate about, what antibiotics and exactly, the timing of these things and how quickly all this needs to happen. But the sooner the better. Certainly getting the patient brought to the hospital and started on these IV antibiotics is really, really critical in halting the progression of the appendicitis. So what you're referring to is it gets inflamed, and as time goes by, that inflammation turns into more and more serious infection. It can lead to what we call rupture
Yes.
of the appendix, and ruptured, perforated, gangrenous. That appendix basically is going to go through a progression. Once the inflammation starts, it's going to go through a progression to death, and basically turning to gangrene, and which it makes it fall apart, and bacteria spread all throughout the abdomen, which can lead to sepsis.
Yeah.
Sepsis is obviously a very severe, overwhelming infection that is affecting the entire body, and so the beginning of IV antibiotics is the key for beginning treatment there.
And the earlier, the better.
The
I
earlier the better. Within it, from the onset of symptoms, and again, every kid's a little different. The size, age of the patient um, is affects all this, but in general, within a couple of days, the smaller kids within 24 hours can progress from just a little inflammation to rupture. So that group that's 5 years old and under, about 80% of them that show up to us have already ruptured when they get here. So they get sick in a hurry. Whereas
Yeah.
the older kids, and a lot of this is just their anatomy and how thick the appendix is and things like that that make it progress quicker. But the older kids usually within a day or two, if they're not within 24 to 48 hours, if you don't get them started on antibiotics, it will progress and it just gets worse and worse as each day goes by.
So yeah, your teenager's not really trying to get out of a biology test. They could really have a serious issue.
Yeah.
I, I,
Yeah, I think that's the key. I mean, kids complain a lot, and I know, as a parent myself with 3 kids, I had one of my kids get appendicitis, and it
yeah,
took me about 12 hours or more to figure out that he had it and really take him serious, and we went to the hospital. But I think, and I had a suspicion from the moment, but kids complain a lot,
yeah,
what's just some constipation and stomach ache, and what is real. And this generally shows that itself that it's real, over a
pretty.
6 to 8 hour period.
Well, and the other thing I guess you're saying is it does not resolve on its own. It only gets worse.
Right. Yes. It will. You may see patients that have, maybe started an oral antibiotic for some reason or another. Maybe it's felt that they've had an upper respiratory, but they're on an antibiotic for some reason. You can see those patients get kind of partially treated and almost trick us all that they have it. So that other than that, yeah, it's not going to get better without antibiotics and the surgery.
So, let's talk about surgery a little bit. We've talked about the appendicitis and the progression of it. If your child does have to have surgery, and it may be a child's first surgery, how do you talk to them about that? How would you talk to your kids?
Sure. Yeah. Surgery, the word surgery is a scary thing for anybody, especially kids, parents. It's tough. I think we do it every day. So sometimes, it's easy to not really think about how, each parent might take this. But, we're blessed to have a children's hospital here that has lots of resources. Uh, the child life specialist, the nurses in our pre-op areas and on our floors are very good at easing parents. This is what they do every day. I hope myself as a surgeon for children that's what I do. That's what I'm used to doing is comforting a parent as well as a kid as much as anything. And you just learn over time how important that is. And it's just, trying to, get on their level and help them understand, that we're going to get them better and that they're going to be okay. And I think as the parents are here and get to meet all the different caregivers that are really good at what they do, it puts them at ease.
Yeah.
It is an easy not fortunately this is an easy surgery. Generally when we catch it timely, it is. And the patients do super well. We do a lot of these minimally invasive, so we call that laparoscopic surgery. That's also the importance of catching it in a timely fashion is it makes these easier surgeries more likely to be successful and the kid gets over it and goes home and sometimes goes home the same day. That's pretty unusual, but in a case where maybe we do it early one morning, sometimes if we've caught an early case, they may go home later that afternoon or that night if they live local and things like that. In general, they're going to stay at least a night, and then
Uh-huh.
some of the bad cases stay 3 days, a week or more, and some of the really severe ones.
Hmm. So, yeah, so having a team that really understands pediatrics and pediatric surgery sounds very important for those kids and for the parents.
Very important. Children's health care, I think, is just sometimes not appreciated, but just under recognized. Just how important it is. My message would be for all parents, when you have a kid that's sick, get them seen at a children's specialized center, whether that's an outpatient pediatric clinic or the pediatric ER we have here in Tulsa. But I do think there's a big difference between, certainly infants and toddlers, but all children and adults. Where that line is, where it's not much different, I think is a little gray. And, certainly the older, large teens, it really probably doesn't matter if they come to the children's hospital or wherever. But I think appendicitis is something that is super common in children. We have a child in that children's hospital with appendicitis. I would say 1 to 3 children that we're seeing that are inpatients almost every day of the week. So it is super common.
That's a great way to end, because I think we need to remember it's common. Get the kids in early, believe them if they're having pain and symptoms as you described, and work with someone trained in pediatrics. It sounds like that's very important as well. So
Absolutely.
anything else you would like to leave us with? This was very informative.
Thank you. No, it's been a pleasure. And, again, I think my final word would be for parents out there, just take complaints your children have serious, get them checked out. I mean, it's better to be safe than sorry. But, even again, as a parent myself, I understand that, we all get busy and, it's easy to trivialize, but, the kids usually, know when they're sick. And, fortunately, most parents are really good at this, and the parents know better than we usually do. They know when their kid's not right. And so just get them to the right place, and hopefully we can get them taken care of.
Yeah. Thank you so much. Thank you, Dr. Berch. I want to thank Children's Hospital at St. Francis as well for helping us bring this information to parents. It's really important. You can find this interview and others in PJ's Corner in Tulsa Kids Magazine or at TulsaKids.com. Thank you.
Thank you.